Are you comparing Medicare supplement plans versus Medicare Advantage plans and wondering which plan is best? In this video, we cover all the ins and outs of the two plans. Hey guys, Alex Wender here, founder of Blue Wave Insurance, where we help folks across the country with their Medicare needs. Before we get into the nitty-gritty of the two plans, let's discuss some basics first. Both plans, the supplement and the Advantage, require you to have Medicare Part A and B in place. Part A is generally premium free if you have worked for 10 years, and Part B does have a premium attached to it that you must pay the government. That premium is $174.70 per month for most people in 2024. Medicare Advantage plans are also known as Part C plans. These plans are offered by private insurance companies and combine Medicare Parts A and B together. They take over your original Medicare and become primary. These plans often have networks of doctors you must stay within, and often they include additional benefits like dental, vision, hearing, and prescription drug coverage, depending on the plan. Medicare supplement plans, also known as Medigap plans, are offered by private insurance companies and pay second to original Medicare. This means Medicare remains your primary coverage and allows you to see any doctor anywhere in the country that takes original Medicare without a referral. So let's dig a little deeper into the two plan types and discuss some pros and cons of each plan option. So probably the biggest advantage of the Medicare Advantage plan is the low monthly premium and the convenience of the included drug coverage and the dental, vision, and fitness benefits. Most plans are $0 per month. Now keep in mind, you still have to pay your Medicare Part B premium to the government. Some disadvantages of Medicare Advantage plans would be the potential out-of-pocket costs, provider networks, and potential for prior authorizations for certain services. With most Advantage plans, you'll have what's called a maximum out-of-pocket, which is essentially a stop loss for your out-of-pocket costs for the year associated with co-payments and co-insurances. The annual max out-of-pocket, depending on the plan, ranges between $3,000 and $7,000 per year. You can find some HMO plans in some parts of the country that have a very low max out-of-pocket, $1,000 or less, but those types of plans are going to have tight provider networks and less doctors and hospitals to choose from. Speaking of networks, another downside to the Advantage plans is the provider network restriction. Advantage plans generally come in the form of an HMO or PPO. HMO plans tend to have more restrictive networks and usually require referrals to see certain specialists. PPO plans offer more freedom and normally don't require referrals to see specialists, and you can generally get coverage out of the network at a higher out-of-pocket cost on a PPO plan. Regardless if you're in an HMO or a PPO, if you are in an emergency situation, you'll be covered as if you are in network regardless of where you go for treatment. Also, the prior authorizations can be a potential issue for some folks. Certain services require you to get prior approval from your Advantage plan before the service will be covered by the plan. This can cause delays in getting treatment, such as surgeries. So overall, the Advantage plans have the convenience of low monthly premiums and added benefits, but there are downsides that you need to be aware of. We always make sure we go over all the potential costs and risks with our clients before enrolling them into an Advantage plan, so they know what to expect. Now let's talk about Medicare supplement plans. These plans provide the most coverage and freedom versus Advantage plans, but there are also some drawbacks as well. The biggest downside of the Medicare supplement plans is the cost and the potential rate increases over time. Insurance companies in most states will increase rates over time, generally anywhere from 0 to 5% or more, but that can be higher. The factors that affect the rate increases are claims, inflation, and cost of doing business. Medicare supplement plans come with a monthly premium. This can range anywhere from $80 to $150 per month or more, depending on the plan you have, your age, and where you live. In addition, Medicare supplement plans do not cover prescriptions, dental, or vision, so you will need a separate policy for those items, such as a standalone prescription drug plan or a standalone dental or vision plan. Now, the advantages on the supplement plans are that they provide the most coverage and allow you to see any doctor anywhere in the country that accepts original Medicare without a referral. In addition, you have almost no out-of-pocket expenses other than the Part B deductible on a Plan G, but there'll be no co-payments. Plan G is the most popular supplement plan in 2024 because it's the most comprehensive plan for folks who are new to Medicare. So with the supplement plan, you get the most coverage and freedom, but you will pay a premium and you will have rate increases over time. So which plan option is best? Deciding on which plan option to go with really depends on your financial situation and your preferences. If you can afford the premiums on a supplement plan and a standalone drug plan, you will enjoy the most coverage and you'll have the lower out-of-pocket as far as using the plan, co-pays and deductibles and things like that go. If you prefer to keep the premium low and you don't mind taking on more of the out-of-pocket costs such as co-payments and deductibles and co-insurances, and you don't mind using a network of doctors, then the Advantage plan could be the best option for you. However, if you are on the fence and you are turning 65, we always recommend starting with the supplement plan if you can afford it. This is because you only get a one-time 6-month window to purchase a supplement plan without any health underwriting when you're new to Medicare Part B. After that window closes, you may have to answer health questions to get a supplement plan, and you can be denied. Now, you can always go from a supplement plan to an Advantage plan without any health questions, but going from an Advantage plan to a supplement plan may require health underwriting, and you can be denied depending on your situation. Now, there are some special circumstances such as what they call guarantee issue situations and trial rights that may allow you to get a supplement plan without health questions. Also, there are some states like New York and Connecticut that don't have any underwriting on Medicare supplement plans. So if you're looking to compare plan options, give us a call at the number below, or you can book an appointment with us using the link in the description below. We work with Advantage plans and supplement plans. We charge nothing for our services and would be happy to help you out. If you enjoyed this video, don't forget to click like and subscribe below to stay updated on all things Medicare and all the latest changes. Thank you for watching, and we'll see you in the next video.